Welcome back. This is World Insight. Next, let's take a closer look at the coronavirus spread in the Netherlands. With a population of nearly 17.5 million people living in a land area of 33,500 square kilometers, it is not densely populated compared to many, but it so far reported more than 50,000 confirmed cases and was forced to do a lockdown. How's the Netherlands doing with testing, contact tracing, COVID-19 prevention and control? Earlier, I talked to Feike Sijbesma, the special envoy of the Netherlands for the coronavirus crisis. He's also the honorary chairman of the Royal DSM. He told me how his country is gradually moving toward an easing of lockdowns and the lessons it has learned so far. Tell me about what do you consider as the biggest challenge regarding testing, contact tracing, prevention control?
Yeah. First of all, this global crisis, we started as a healthcare crisis, and due to the measures that all countries took, became an economic crisis. And I regret that we were not prepared and we didn't see it coming. Tian Wei, we even didn't see it coming when it was coming. In the beginning in Europe, we thought this was China or Asia and Italy. But it was the entire Europe and later on also the US. So even when it was coming, we were surprised. And what we did in the Netherlands is reducing the spreading of the virus within the capacity of healthcare via the lockdown measures. And we succeeded in that because we could handle the virus and the spreading went down. Now we are in the exit of the lockdown, and what we do is in the Netherlands 1.5 meter distancing, no big events, and if there is an event or meetings, small, big, 1.5 meter distance. Protection like sanitizers, mouth mask in public transportation, etc. And testing. A lot of testing and tracing. Everybody can be tested in the Netherlands. This was really a challenge because 2-3 months ago when I started on request of our Prime Minister and Cabinet, our Health Minister, there were not enough tests. Now everybody can be tested in the entire country.
Leading your company, DSM, have been contributing, in fact, with no profit at all, for the nose swab testing, which is about the PCR test. What about the accuracy rate as it has been a big issue for many countries?
We only use the real PCR tests. We do not use fast tests in the Netherlands because the fast tests are not specific and not sensitive enough. So the country is only using the official test, which is a 98% sensitivity. So it's pretty accurate. DSM indeed helped to contribute with swabs, but also with sanitizers and mouth masks and all that stuff we manufacture at cost to help the government. And at this moment we have enough tests. We are ramping up now for the winter season, because in the winter season people have more respiratory complaints, and we might do double or double of the tests.
The winter season is going to be a big concern for all of us, isn't it, Feike? Because the regular flu season coincides, what if, with COVID-19? We have never experienced that before, that combo. What does that mean for us? How is the Netherlands, you know, under your current circumstances, still trying to open up, but at the same time prepare for the best and the worst scenarios?
Yeah, it's a very good question, and it is a very big concern also. Now with the opening up, we really need to take care that we take and keep this 1.5 meter distancing, that we wear our mouth mask and we do the testing, and after the testing is positive, immediate isolation. If we don't do that stringent enough, then we take the risk in the winter season that we get a second wave. If we get a second wave, we might have a second lockdown, and that would be, next to the healthcare problem, that would create a huge additional economic damage and a lot of people losing their jobs or companies who go bankrupt. We need to prevent that. If a second wave happens, of course we are better prepared than this first wave, how to react, but I really hope this won't happen, because especially economically it will give a big hit. We need to work also what I call the so-called final solutions, and that is the treatments or the vaccines. And at this moment I'm busy for the Dutch government also to help on the vaccines.
Earlier, I understand the head of the European Science Council resigned at the very beginning of this pandemic, who said that he felt it was very much bothered by the lack of budget for scientific research in this regard. Now, how are European countries now trying to function in that area? Are different countries trying to have their own approaches, and how does that work?
Yeah, how can I say? It is a concern. What I have seen in this whole crisis is that all countries worked for themselves. All countries bought their own guns, their own mouse masks, their own tests, and now even their own vaccines. There's not a lot of collaboration. Whilst this is a pandemic with a virus which does not show its passport when it crosses borders. Like, by the way, we get more issues like CO2 is not showing its passport either at the borders, and it's also a cross-bordering issue. And I think in issues we need to collaborate and not work only separately. But I need to conclude that this is not the litmus test of collaboration, how we did it so far. On the vaccines now, we start to collaborate in Europe at least, but still not globally. And I hope that in the evaluation of this whole COVID-19, we come to the conclusion that for cross-bordering events like this pandemic, like climate change, we need to work together. And we did not do that so well in this crisis, I think.
Europe is known for open borders and free-wheeling interactions, but COVID-19 forced the many member states to close borders within the EU and also to go into lockdown. Coupled with rising populism and protectionism, Europe is not spared from the deglobalization in the world. What can help deal with this reality and lead global cooperation back on track? Mr. Sijbesma also shed some light on that. I understand, Feike, the latest list of countries, citizens from countries that are welcomed into the EU area, plus 4 other European countries, only a dozen. So will that list get longer? How do you see the selection of countries? US is not included. How do you see the potential of the speed of opening up? How do you see now Europe, which is well known for opening borders and also opening the interactions, now have to deal with the realities?
Yeah, it's a good point. We need to collaborate between countries whilst we have the borders closed, but that is what is the situation. Now, in the exit of the lockdown and the distancing and the mouse mask and the tests, we're now opening up some borders also, especially in Europe, hardly from outside Europe to the Netherlands or to other European countries yet. And I think we will evaluate that after the summer, maybe in September or something like that. I think till then we will first want to see what will happen after the holiday season with opening up the border in Europe, and whether that will go well. If so, maybe at a certain moment we can go further to other countries. But for now we need first to see how the traveling in Europe will not spread the virus further, and it's the first thing we investigate now.
Feike, as you may know, large countries such as the United States, and particularly the United States, there are already 12 states that have seen, after its reopening, the number of confirmed cases surged like rocket. And some of them have to close down again gradually. So how big a lesson is that for all of us, for Europe particularly, because you are valuing the opening borders so much? That's what EU is about, isn't it?
You're right. It's a huge lesson, a huge lesson. So the big lesson is that once we are in an exit of the lockdown, that does not mean everything is open, everything is free, and you can do what you did before. No. And it is not normal to keep 1.5 meter distance. It's not normal for mankind, but we need to do that.
Mm. And that is the new normal. What is new normal to you, Feike?
1.5 meter distancing, etc., is not a new normal, because it's not normal for people not to touch each other, not to hug each other, etc. That's not normal. And therefore, we need to work on the vaccines and get that done and back to the real normal as we had before. This cannot continue forever. It's totally unnatural for mankind. Mm. But the real normal for me has to do with what do we want to achieve in this crisis. Do we all want to go back to an ancient point in history, January 2020, when life was still so-called normal? Do we want to get back to that moment and do the great restart? I don't think so. I think we need the great reset. And since the world is spending trillions anyway, I hope that a part of that money we spent on making the world a little bit better and addressing other issues as well, like sustainability, like climate change, like inequality, because the world was not pretty in January 2020 either.
But are you being realistic, some might ask you, Feike, for saying so? At the time of crisis,
Why?
You said yourself earlier, all countries look within its own border rather than reaching out to help or looking at international collaboration in a larger scale. Meanwhile, they try to bring up the economy, give jobs. Those are likely to be areas not necessarily going to be favored, let's just say, related to the issue of climate change or environmental protection. So how do you see the reality vis-a-vis the aspiration you expressed?
It's right. It might be very tempting for countries to save money and not to invest and maybe to take care of themselves again. It will be very tempting to do so. But then it will, at the end, hit all of us harder with climate change, with inequality. If we let Africa and Europe down now, it will hurt us because immigration will increase and it will create tensions. I think what we can do is learn also from the last really big crisis that we had in Europe, the Second World War. After the Second World War, where a lot of money was disappearing and a lot of things were destroyed, the Americans came with the Marshall Plan and not asking Europe a favor, but investing in Europe. And we start investing and not saving money. And I think this is also the moment to invest collectively into a better future with climate, with inequality, in order to prevent further disasters into ourselves. But I agree with you, that's a challenge. And I agree with you that it is tempting to look to the short term. And I agree that it is tempting to work only on yourself. But this is, for me, not the solution. And we need leaders who see that, and leaders who can guide us through that period.
There's going to be no savior anymore. Feike, you know that very well. It's not going to be like after the Second World War. It's not going to be people rallied for the right cause against the wrong cause, because our enemy is the same. It's the virus. There's not going to be economies that are doing much better than all the other economies, because our economies are all interlinked. And we are all in this together, and yet the situation was different from the end of Second World War, if I could argue.
I totally agree. You cannot compare it totally with the Second World War. I only take out of the Second World War that there was a Marshall Plan and that people were caring about each other. That's the comparison I make. And of course, situation is totally different right now. Indeed, all countries are interlinked via globalization. But let's realize there's also a kind of nationalistic feeling already for a couple of years in all kinds of countries in the world. Because globalization brought prosperity for billions of people and for many countries, but not for all people and not for all countries. And that inequality, I think, is a big concern in countries and between countries. And this virus could increase the inequality. People lose jobs, but other people don't lose jobs in countries. That could increase inequality. Some countries maybe have vaccines or measures, and they can easily go out of the lockdown and start their economies, and other countries maybe less. And that inequality, I think, need to be addressed collectively to the benefit of all.
Feike, I hate to bring it up, but it's a part of the reality we're facing today, that is the geopolitics. I've been talking to some of the current and former officials of international organizations and multilateral platforms. Many of them have been suggesting, if not complaining and concerning, about the extreme lack of international cooperation they have ever seen in their public life today. So how do you think, on the one hand, yes, there's huge need for international collaboration. On the other hand, even the WHO has been severely questioned, and funding for it has been withdrawn by certain countries. And there's likely to be very different approaches by governments toward COVID-19. And if virus is not being stopped at the border, it's likely to spread once and again, over and over and over again, until it kills millions and probably even more than that people. So, Feike, you've been an internationalist. Tell me more about how you see these different aspects of reality.
We already partly discussed that by discussing globalization.
Yes.
We are dependent of each other. We cannot deny that. We see in this corona crisis that we are interdependent. We see in the climate that we are interdependent. So economically, health, environment, we're all interdependent. And that means that we need the international organizations, like the Nations, like the World Trade Organization, like WHO, etc. That we need multilateralism and not bilateralism only. And that we need to work together. And it is really something we need to do, but I realize we do that in an atmosphere, in a world, in a tension, where a lot of people looking only to national or domestic issues at this moment. And the solution will not be there. The solution, and we discussed it already, the solution of the coronavirus will only be to do something together. Otherwise, you need to keep the borders closed forever. And that's not the society which we want.
Right. There is an issue of the size of the country. Now, bigger country with bigger markets, once the border is closed, probably has a better chance to be able to handle it. It really depends on how they're handling it, by the way. But smaller countries, geographically speaking, will have a difficult time because they have been functioning very well on global supply chains and global production chains. So tell me more about, before we go, your country, the Netherlands, is trying to figure out a way at this point.
Yeah, for smaller countries, it is essential to continue trade with the countries outside your own country. In Europe, there is a discussion. Almost none of our generic medicines are being manufactured in Europe. Should we not restore that a little bit for some products and manufacture that ourselves? So I will see some changes, but the action between countries remains, and especially for our tiny little country, the Netherlands, essential for the future.